Good afternoon and welcome to another episode of RVonAV. I'm Rich Ventura, the Vice President of B2B for Sony. And today's topic is going to be on healthcare, which I think is on everyone's top of mind. And I want to welcome our panelists for today. We have Maggie Austin, Regional Vice President for Healthcare for MDM Commercial. Thomas Kam, Global Segment Marketing Manager at Healthcare for Intel. Julie Holodak, Director of Healthcare Solutions within Sony. And then Matt Schmitt, President, Reflex Systems Incorporated. Welcome, everybody. How are you doing today?
Good, thanks.
Hey, Rich.
Good.
Great, Rich. Thank you.
Excellent. Well, you know, what I'd like to start with is maybe have each of you talk for a minute or two about your organization and what you do, because I think it'd be really good to help set the table for this conversation. And I'm going to start with Maggie, since you're in my top left. Maggie, tell us a little bit about yourself.
Yeah, absolutely. Thanks for having me today, Rich. I'm Maggie Austin, Regional Vice President of Healthcare for MDM Commercial. I'm responsible for driving the South Central Territory sales cycle for MDM, and I present patient-focused healthcare-grade TV systems, Journey PX cloud-based patient experience software, and digital signage solutions to leaders in healthcare. So that includes directors of engineering, CIOs, CNOs, directors of facilities, and I collaborate with my healthcare customers on a daily basis and work to provide them with AV technology that helps meet them and their goals as an organization.
Excellent. Well, welcome again. Thomas, we've got you kind of late at night overseas. Hopefully all is well. Tell us a bit about what you do at Intel.
Sure. So I'm Thomas Kam from Intel Corporations, and currently I'm based in Malaysia. It's because due to the pandemic lockdown, so I kind of staying here in my own home country. My role is cool and visionary as a segment marketing manager, global for healthcare, especially in partnerships and edify the digital transformations and smart infrastructures for healthcare, smart cities, and transportation segments. My primary focus is on intelligence infrastructure solutions and artificial intelligence or deep learning solution based on Intel architectures, all right, and also edge computing. Through partners, proven solutions, whether it's in a new use case study, new use case scenario, new revenue streams, or technology enabling, together it could reduce the time and cost and also the risk of edge device deployments. Thank you.
Thank you, Thomas. Julie, obviously we know each other pretty well as much as we can, considering we've both been working remotely. Tell everybody a bit about your group within Sony.
Sure. So Rich, I've been with Sony Healthcare now for 20 plus years and 27 with Sony as a whole. And I head up the healthcare division for Sony in the US and North America, Canada as well. And basically my role, sales, marketing, product management, is to bring Sony's technologies to the marketplace, whether through our main customers like medical manufacturers or through hospitals directly. So it's been a really exciting, challenging position, particularly during the pandemic. But I think what's great is this group is so passionate about matching Sony's core competencies as well as our innovative technologies in healthcare and helping to improve patient outcomes and workflow. So thanks for having me today.
Excellent. And last but not least, Matt Schmitt from our friends at Reflex Systems. How you doing, Matt?
Good, thanks, Rich. Yeah, just a quick intro. I'm Matt Schmitt. I'm the president at Reflect. We're a platform solution provider focused on digital signage and interactive experiences for out of home. We activate and support digital across a lot of industry verticals, but with a strong focus in retail, financial services, entertainment venues, and healthcare. Our content platform is used by our clients for delivering both public-facing digital media, but also employee and associate-facing applications. And in my role, I get to work on strategy, both on the internal side with all of our product teams and development, as well as our strategic partners that make up the whole ecosystem that's required for out-of-home digital. And I think my favorite part is working with clients on their digital strategies. So everything from discovery and planning to content strategy, and then into the solution design and AV approaches. Really enjoy that. So thanks for having me.
Perfect. No, definitely. It's a great panel. We got a lot of great information that's going to be happening. And please, everyone, remember there is a Q&A. So, post those questions. We will be answering as many as we possibly can throughout the day, throughout the time here. And then afterwards, we'll also make sure to get back to everybody. So please, please, please make sure you post any questions you have. So why don't we get started here? And, we're going to kind of go through some key discussion topics. We're going to talk about emerging technologies that are going into healthcare, talk about what's needed to be successful in the healthcare space, trends, innovations that we're seeing. Obviously, it wouldn't be a session about healthcare if we didn't talk about the impact COVID's had. We'll talk a bit about that as well. So, maybe I'll start off with you, Maggie. And big picture wise, where are you seeing the investments in healthcare going?
Yeah, absolutely. I see as a company, MDM, we're seeing investments in patient experience and patient education technologies. This technology typically comes in the form of cloud-based applications implemented on smart devices. So that would range from digital signage displays to TVs, to tablets, and to mobile devices. And these cloud-based applications integrate with the hospital's EMR and deliver real-time information to the patient. So a couple examples for you, a nurse could prescribe education to the patient room TV or mobile device, or you could have EMR data mapped to a digital signage display in the patient room, and that would act as a digital whiteboard. So you typically these days see dry erase boards in the hospital room, but hospitals are making investments in patient experience and moving towards digital whiteboards. The reason why my hospitals are focusing on these areas is because they're looking to improve HCAHPS scores and to reduce readmissions. So patient experience in a lot of studies has shown to drive positive clinical outcomes, strong financial results, customer loyalty, community reputation, and then family and patient engagement as well. So it's really an area worth investing in.
Okay. So Matt, you mentioned obviously in your intro, talked a bit about your focus with out of home or with healthcare as a whole from signage perspective. What areas are you seeing those investments happening right now?
Yeah, so on both the hospital side as well as healthcare providers in general. So when we look across general practices, specialists, our clients that power engagement solutions for patients and providers, we're seeing the investments be on both fronts. There was a lot of focus already on patient engagement solutions before COVID. Now we're seeing a lot of focus in how to use digital in more of that kind of omni-channel way in healthcare, similar to some of the efforts we've seen in other industry verticals. So it's a combination of things. We're seeing more of an investment in educational content from an engagement perspective, and then interactive solutions that help the provider and the patient consult together, whether that's remote or physically in the venues that we put in digital signage. So it's across the variety and has been growing pretty rapidly, but it's really refreshing to kind of see the importance being put on both the content side and really putting ourselves in the patient's shoes on what those efforts are.
Okay. No, great. And I think the thing that we're all seeing, and I think we've all seen this, is the evolution of the technology. Like you said, Matt, prior to COVID, people were deploying it. Now they've completely changed what that content looks like and the message that they're deploying. So Julie, with your business, obviously, COVID has been the cornerstone of a lot of the things that you've been dealing with, especially since you and I've met. I mean, what are you seeing those investments within healthcare when it comes to the solutions that the healthcare organization offers?
Yeah, I think, COVID absolutely has had such a major impact on healthcare facilities. And I think, one of the things that came out of, of the pandemic were really centered around how facilities are able to react to crisis management, crisis situations, and what their, plans were. It exposed a lot of gaps. And certainly one of the things that hospitals are now focusing on is reducing contact, finding ways to, maximize space within the facilities. Telehealth, of course, is a major, it's always kind of been something in the background, but now it's really foremost in the front, where physicians are looking to consult with patients remotely or consult with other physicians remotely. So anything that can reduce contact certainly is at the top of mind of these facilities. I think also one of the other things that was learned is, how important spaces. So anything that reduces the footprint of equipment to free up space, to provide, better patient experience, better patient outcomes, certainly is important. And I think, one of the other things that that really remains important, again, I think somebody had said, anything that reduces cost, improves workflow, or improves patient outcomes. I mean, that's where hospitals are going to be spending their dollars.
Okay, cool. So Thomas, you've got a kind of a pretty cool job here. It's maybe dive into it a little bit more. I'd like to understand more of what you're doing at Intel.
Okay. So over here, I did prepare a short video clip so that
Okay.
I can compact it and so that the rest of the people can enjoy this 1-minute video clip. What is the new use cases for this during this COVID? Let's play back the video.
Self-care kiosk solutions. Use case. Hello, I'm Thomas. Allow me to introduce to you Self-Care Kiosk, a new experience. It's never been easier for someone to generate their own health infographic. Here's how. Meet Dave. Dave loves staying fit and healthy. In fact, once a week, when Dave goes to the mall, he performs his very own health check. He does this using an individual self-care kiosk. Once he's registered himself, the self-care kiosk will identify him through biometric and mobile phone recognition. Then, Dave is free to perform simple vital body checks, like measuring his weight and blood pressure to generate a health report. If you have any questions, please get in touch with me, and together we can co-create a better, simpler, and more cost-efficient user experience.
Well, hope you guys got this 1-minute video clip in a compact 1 minute. So the main point is because of COVID-19, people used to, when you are sick, only go to a hospital or go to the clinic. But because of pandemic, people are more cautious about their wellness, about their body vital signs. And that's why these new use cases is kind of happening not only in the developed countries, but also in the developing countries as well. Back to you, Rich.
Cool. Thank you. No, it's great to see, and I think we've all seen this quite a bit, the pivoting that we've all had to make in our business. And it isn't just business as usual. Maggie, thinking about your business, I mean, how has your role evolved due to COVID?
Yeah, absolutely. Well, I do have to say, MDM, we are a value-added reseller and an integrator. So I'm not sure, we've totally changed, but I would say that now more than ever, our role as consultant and a collaborator for our customers is more important than ever. And that's what we're really focused on. Not just a vendor, not just a supplier, but we're really focused on having those in-depth conversations with our customers about what is going to help them. We've had to adapt and be more flexible with project timelines and project management, trying to keep projects that we had going at the start of COVID on track if we could. We had to work with budgets and billing structures. And then we also had to talk about what technology really made sense and was most crucial for our hospitals. And we had to, really play that consultant role more than ever.
Cool. Yeah, I think, we've heard this in some of the previous RVs on AVs that we've had. We've had different integrators on there, and it's really interesting how the integrator has gone from being, in a lot of cases, a supplier to being a mission critical part of the relationship or part of the team. And you become less and less interchangeable than you used to be, which is great to see that there's that value add is there. Matt, if you think about where you're at, because you're in a little bit of a different, unique position. You're a manufacturer of the software solution. You can sell your solution as an integrator. You talk at the strategy level with your partners. How has your business or your roles really changed?
Yeah, as far as the reacting to COVID, so obviously, things changed as far as being out there, collaborating as closely with clients and organizations that are putting in solutions into healthcare. I think the big one for me has been staying in touch and collaborating as effectively as possible, especially with distributed and remote teams. Not just our internal teams, but I would say with clients and partners as well. And the biggest thing we've been focused on is really constantly circling back just to make sure we're reinforcing key priorities. We're actually measuring against strategies and objectives with our clients and how their content programs are working, and kind of keeping initiatives moving forward while everyone is reacting to pivoting quite a bit, especially with looking at how to change the nature of digital in the physical locations for the hospitals and providers to make that a more blended physical digital experience. So there's a lot of assessment going on how to move that stuff forward and how to kind of create that new blueprint for what works now in kind of a different environment where people are coming back to the locations and prefer that, and others who don't, and how do you do those effectively together?
Yep. Oh, definitely. So Julie, as a manufacturer and really with your group and so heavily focused on healthcare, how have you seen your organization's role change due to COVID and due to a lot of the pivoting that we've seen in the industry?
Well, I think, one of the things that has become extremely apparent as a manufacturer is that we really need to listen. We need to listen to the healthcare professionals in a way that we haven't before. These people are busy. They're busy saving lives. They are busy, trying to maximize turnover. And so I think from a manufacturing standpoint, we really need to not necessarily force our technology onto the facility, but rather adapt our technology in a meaningful way that allows surgeons and clinicians and nurses to really improve their workflow, to improve patient turnover, which ultimately reduce costs for the facility. So I think that's key in terms of the way that we need to pivot. Also, I would say, where we play mostly from Sony's perspective is in the operating room. So when you're looking at the way when hospitals are now building new facilities, they're looking at areas that can be used for multiple different types of disciplines. So I think any products that cross over and can be of use to multiple stakeholders within those operating rooms is really, really key. So for example, like in a hybrid operating room, you may have, the surgeon really becomes kind of like the pilot that needs to see access to all different kinds of information. So giving access to that surgeon to best perform surgery, knowing what the patient records look like, maybe accessing a CT or MR scan, and just having information available to their fingertips to improve that process is definitely key. So anything that helps to keep the hospital up and running and to improve costs is definitely key.
Thank you. So, Thomas, those who don't know well enough about Intel, everyone thinks obviously of chips, but I look at you guys much more as an IoT company with all the things you do around analytics and the stuff that you've built into the stuff. Talk a bit about IoT itself and how it's really changed healthcare.
Okay, so I think IoT, most of people get it. It's all about edge devices. But how are you going to aggregate all the IoT edge devices? That's where to be successful in this healthcare market, I think we need to leverage on the industry expertise. It's not only Intel, but with our partners and as well as our customers, as a doctors, as a nurse, and as a patients, that we need to hear all the inputs that comes in, and then how we can collectively integrate all these pain points, all these challenges, so that we can come together to bring a solutions that able to provide to the customers and also to the patients as well. Besides that, I think business model, we also need to understand partnering with a technology provider such as MDM and also Matt over here helps us to understand what is the business model, what is the challenges, the pain points of a typical hospitals that could bring value to the hospital operations and also the clinical teams. Yeah, that's.
All right. So, Matt, one of the key things, obviously, with IoT, it's data, right? We're getting all this data coming in from sensors and everything like that. And one of the questions that came up was a very interesting one, and I was thinking about the way we want to best address it, and it was around Hipaa and privacy with all this data that's coming in. I think we've seen, we've seen, at least definitely in this last year, we've seen a little bit of a relaxation on the concerns about cameras with analytics and things like that. I mean, what are you seeing or hearing from your customers when it's coming about data? I mean, are they using it better now? Are they getting a little more relaxed about the data? Are there still a lot of concerns about Hipaa?
Is that for me, Rich?
Yeah, I'm sorry, Matt. Yeah, that was for you.
Yeah, absolutely. Yeah, you're right. I think people have been more open to using sensor technologies for measurement and analytics. There are still some concerns about camera because there's been a lot of confusion sown in the consumer market around the idea of facial recognition, which is not really what we typically use in digital signage. We're typically doing anonymous video analytics, but it's hard to educate people on the concerns around that. But we are seeing more use of the sensors from both camera side, Wi-Fi analytics, even things like motion sensing and heat mapping. But the reason behind that is, to then make the solutions better, whether it's making the content better and more relevant that we're programming, or providing a path for patients that do want to provide more data about their own issues or problems that they're dealing with, or more importantly, to give them more information. So making it so that it's not a privacy issue and being sensitive to that, but giving them those easy digital tools, whether it's them texting or QR coding and then getting information they can take with them to learn about a particular disease, for instance, or a particular issue that they would like to educate themselves more on. So there is a need to navigate more of the data and to be able to use that for analytics, but I think there is definitely still a lot of hesitancy on treading carefully on that path.
Okay. So Julie, with the solutions that your team delivers, how much are you talking about with their customers around things like data privacy and HIPAA and things like that? I mean, what are you hearing out of your customers?
Certainly, patient privacy is absolutely at the top of the list in terms of, facilities making sure that they're HIPAA compliant, making sure that patient data doesn't get out there. I think, as Matt pointed out, I think what we're seeing now is clinicians and even admin IT folks can really see the value of capturing that information and utilizing it in a meaningful way. When you talk about AI, being able to capture that data, something as simple as tracking how many times a person comes in and out of a room, or how long a doctor is spending time with a patient. Is the staff following protocol in terms of, hand washing and that type of thing to make sure that they're adhering to the protocols. When it comes to patient data and privacy, I think what customers are now seeing, particularly in surgery, is that recording and capturing these new surgical techniques are far more valuable in terms of training and education and improving patient outcomes, improving surgical techniques, and using that data, in a way that just helps the facility to improve the patient experience, again, maximize uptime, keep things moving. So I think we're starting to see a shift in terms of how that data is captured and what it is used for.
Okay. So Maggie, when you're, obviously we talk a lot about digital signage, and I know that's a lot of your background from previous lives that we both were together in. How much are you seeing sensors and IoT devices coming into the customers you're talking to?
So for us at MDM, we're definitely not as involved when it comes to sensors and such and collecting data in that sense. And actually, if I can speak to that HIPAA compliance question as well, I mean, for us, we're talking HIPAA compliance in telehealth and video chat, which there are a lot of technologies out there that are HIPAA compliant. So you're able to video chat in the patient room or at home and still maintain HIPAA compliance. So I don't know that those will relax at all, those regulations, but there is technology that exists that can be HIPAA compliant. So our Journey PX software, for example, which is a patient experience platform, it is HIPAA compliant, and it also has a video chat feature. So you just have to, work with the healthcare's IT team and also, have your technology experts at your company work together to really understand how the technology is HIPAA compliant. So just to answer that question, but when it comes to sensors, that's not something that we so much play in as a company. We're more on the patient experience side.
Okay. All right. So
Richard, can I just
yeah.
Can I just add on this HIPAA, HIPAA?
Definitely.
From Intel standpoints, we understand the exponential power of data, and we are making it practical and economical to put it to work at the edge and also to the cloud. All right. So within Intel, we have a special task force teams. Whatever partners that we work with that use, for example, data to do facial recognitions, we kind of screen through their algorithms, their codes to understand whether this facial recognition, is it for bad use or is it for good use? When I say good use, is that, for example, if this facial recognitions is used to improve the operations or improve the patient experience, then we will be working together with our partners to optimize the algorithm running on our Intel platform. All right. So in certain cases, like in Asia Pacific, the government also need to be involved. For example, they allow facial recognitions, but the data is not kept in a storage. It kind of a sensor that take your features of your face just to recognize that you are the patients, then they allowed you to go through the whole what they call self-registrations, or to optimize the whole process instead of queuing for a registration to register your records. So this is depends on the policy of the government as well.
Okay. All right. So Thomas, tied with this stuff, what are some new solutions that Intel's developing that's really helping integrators and manufacturers generate new revenue opportunities?
All right. So I also prepared a second video clip. All right. So this is to give you an example how with the new technologies and the new trends, it could generate a new revenue streams for our partners and also the customers. Let's play back the video.
Self-care kiosk solutions. Value-added service. Hello, I'm Thomas. Allow me to describe how the self-care kiosks help users to receive thorough and comprehensive information as a service. It's unlike anything else. It's all to do with telehealth innovation AI technology that complements expertise. If there are any spikes or warning signs within the health report, the kiosk will trigger a health consultant to connect with Dave and advise him on what should be done. Often, it can be as simple as getting some rest or taking a supplement. Supplements can be made available through a kiosk dispenser. If it's a little more serious, the consultant may advise Dave to visit his doctor. The self-care kiosk even gives you an excellent opportunity to advertise on the screen for a new revenue stream. For a better customer experience, improved operational efficiency, and new revenue streams through the AI telehealth service and consultancy, the answer is simple: self-care kiosks. We would love to further discuss with you the potential new areas of value creation. Please feel free to contact me here.
So this kiosk does not only helps to create a new revenue streams. It's not only doing advertisements through the digital signages, but the data that is collected, it's used as analytics to provide consultation services to the patients or to the customers, whether you need to upkeep your health wellness or provide a supplement information, or maybe exercise, do a proper diet. All right.
Okay.
And on top of that, I think there's a question talking about SOC. Is it running just only doing digital signages? So traditionally, digital signages is just a playback, correct content. But with the new technologies, the pain point, the new use cases, the SOCs has been needed more processing power, or it becomes it's like a micro server sitting inside a digital signage. All right, it's no longer a small box, but it has different CPU or VPU inside to cater for different workloads. For example, not only digital signages, but to collect, to analyze the data, then how we can provide new services or new revenue stream for the partners.
Oh, perfect. No, perfect.
Thank
Definitely.
you.
So, Julie, I'm going to kind of shift over to you a little bit. And I know we've talked a bit about some great case studies and successes that you've had. And I know you've got a couple of slides you want to talk a little bit about some of the activities that your group has done.
Yes, this actual what we're calling a proof of concept was a case study that we did with Kaiser Permanente in the virtual ICU. And a little bit of history: the needs came up because of COVID. The nurses in the ICU were just overrun with patients, and having to run from room to room, having to disrobe and re-robe into new PPE. It was just really crisis central. And they came to us and asked us to provide a solution whereby they can improve their visibility into the patient rooms. And I love this case study because it really is a marriage of our products, both Rich, from you on the B2B side in terms of pan tilt zoom cameras, as well as our Bravia displays, and from the healthcare side, our Nucleus software platform. And essentially here, what you're seeing is the nurse's workstation that allowed from one central location visibility into several different rooms. And if you go to the next slide, you can see basically what our platform does is it's a software that allows you to acquire images with the pan tilt zoom camera and then distribute and stream those images to a central location, in this case, the nurse's workstation. And although we didn't do any image processing and analytics, that also is, their capability is there, as I talked earlier about tracking, what's happening in the room, following a patient. But just from the workflow perspective, a nurse is able to see in multiple different rooms and be able to make a call to the attending physician to quickly get into that room if there's an emergency, or if a patient is ripping out wires, to get in there and make sure that they don't disrupt what was happening in that critical care environment. And on the next slide, basically you can see essentially where we had the tile overflow, which is a feature that we implemented to help to give visibility across 24 different rooms during the height of the crisis. And in this case, because of this solution, they were able to prevent, they had over 100 interventions. So you can see just from the setup how much that impacted the nurses and their capability to treat patients. And on the next slide, just a little bit more about the setup and how the camera works. You can see the control unit there. The camera kind of identifies the patient, and with the tile, the nurse can pick or select the room she wants to focus on, and then go to a full screen there on the right side to get a little bit more visibility into the room as to what's happening. And then, of course, use that control of the camera to zoom in on the nurses, zoom in on what's happening with the patient, to assess the situation and request the applicable treatment for the patient. So it was really a phenomenal proof of concept with a great marriage of Sony products, as I mentioned. And I think there's one more slide here to show you just another visual of how that camera is mounted overhead in the rooms and what value it provides. So, just a couple of the key benefits, in terms of the crisis when they needed to turn rooms, possibly patient rooms or OR rooms, into ICU beds, they were able to do that. And again, being able to monitor many, many patients at one time was just proved to be extremely powerful in terms of their critical care unit. So just a great story and how the products were used across our different product portfolio.
No, thanks, Julie. And I think it gives us a lot of really good ideas of how Sony's tech can be used. Besides just digital signage, not just digital signage is a lot of things, but also just how our technology goes into the operating rooms. Maggie, I kind of want to come back to something you were talking earlier a little bit about with Hipaa. And one of the comments someone actually asked, I didn't even think about this, telehealth discussions. We're doing more and more of that. Do these have to be stored for audit purposes?
Yeah, so that's a great question. So if a healthcare provider does need to store those, the good news is that at least the technology that we implement at our healthcare providers, the information's never leaving the facility. So we're using a cloud-based platform, but no information is actually leaving the hospital. So you can store those videos because basically it's a two-way communication with the EMR. So everything that's being recorded is going to be put back into the hospital's EMR and is going to, and that's a HIPAA compliant technology, which is great. So nothing's ever leaving the hospital. So as long as you're implementing HIPAA compliant technology with your customers, then they can store those videos if they need to for audit purposes.
Okay, cool. Yeah, it's a question I never thought about. It's the joys of having these chats is you get a lot of different new questions and ideas. So Matt,
Yes.
one of the you talked a lot about is you love the fact that you get to work on strategies with your clients and spend a lot of time on there. Can you talk a little about those steps that you go through in formulating, helping them formulate a digital strategy?
Yeah, as I said, we definitely look at content a lot, but then also on the interactive side, because there's more of that and how to engage. What we don't do is start with the technology. So, when Julie was saying we don't force the technology onto them, that's true no matter what we do, whether it's healthcare or whatever. What we try to do rather is really have a good understanding of the objectives. So what does success look like? What is the audience look like? So in knowing the audience, whether it's patients or healthcare providers or both, if that's part of the objective, is what is the content strategy that then feeds those objectives? Then we look at the environment we're dealing with. So the physical environment, what's possible with audio, video types of solutions, and how much traffic and dwell time and things like that are in the different physical zones of the physical location. And then we'll look at applying the AV solution and whether there are any special engagement things like interactive or sensors or cameras that need to be employed. But that's the main thing that we really do is try to start from what does success look like both for the patient and the healthcare provider or the hospital, and then back up into the content strategy that's going to affect that. And one of the things we saw with COVID was this growing need for real-time content. So rather than everything being pre-produced media that can just kind of be sent out to locations and kind of a traditional broadcast model, is this new need to do dynamic content that is from data, that it can be pulled in and rendered in real time at the edge of the network. That was super important in COVID, as Julie said, also reacting to COVID with critical messaging. And we had seen before COVID that there was a need to be location specific and have relevant and contextual information. And that only amplified with COVID to where it's even more important that each location is able to communicate the things that are particular to their locale, to their facilities, particular issues that they're dealing with. And we saw this growing trend for being able to provide more grounds up content rather than top down. So ground up meaning local team members being able to put in messaging and create content at the facility level and feed that into the systems.
Okay. So Thomas, thinking through some of the things you've heard, we've all talked about today and everything like that. If you had I hate to say your crystal ball, but really where you see that next stage of investment in technology in hospitals, I mean, what do you see that next step being? What kind of technology do you see starting to become more prevalent in healthcare?
I think the technology is improving. I cannot be too specific, but what I want to say is that digital front door, it's the opportunity, whether it's digital signages, whether it's kiosks, whether it's edge devices. The digital front door actually helps to allow the patients, more patients to engage through the digital front door. All right. So when I say digital front door, it's like devices like the kiosks and the signages. So with that, for better patient experience, for customer experience, we need to add in the technologies. For example, touchless, including the camera as well, and some motion sensors to beef up the technology usage of AV solutions in the healthcare. Yeah.
Okay. Mm-hmm. So Julie,
right.
what are you seeing in your future? Oh, Thomas, you still got a little more?
Yeah, so I just thought of one example I thought I can share with everyone here. So just now, Julie did show about the Sony POC that is happening inside the the clinical side of it, the operation theater, correct? So the other more simpler or non-medical devices related, but is related to AV technologies to help the healthcare providers, is that in the lobby of a hospital, digital signage can be used with a camera. You can improve the what they call the operations of the hospitals by providing the informations of overcrowding. Because of the pandemic, we see there's a new opportunity that just pop up. They don't want the patients to be overcrowded in a lobby or in the hall. This is to avoid the 1 meter or 2 meter physical distancing. So with the digital signage and the cameras and with the applications of overcrowding software features, it create a new revenue space for the customers, for the healthcare providers. There's another example is that digital signage and also the car parks, the parking lots. There's another request that comes in to Intel, says that how we can merge these two use case with technologies to provide a parking space, and at the same time to leverage on the digital signage to provide the information for the customers or the patients that drive through or drive into the hospitals.
Okay.
Thank you.
Great. No, thank you. It's great examples. So Julie, what are you do your crystal ball? I mean, what are you seeing the new technologies or applications or uses that are going to be coming in the future?
Yeah, I mean, I think as Matt said, anything that allows for clinicians to have real-time access is huge. You know, efficiencies, quick turnover, any of those types of things are going to improve the hospital, you know, their revenues. One of the things we saw in the pandemic, of course, where hospitals were hit the hardest were elective surgeries, and you know, they essentially had to shut down and you know, postpone a lot of those surgeries. And elective surgery is really a big moneymaker for hospitals and facilities. So, you know, now we're seeing a surge and a backlog of those surgeries. So now anything that can improve that turnover is key. And then also, I think the other thing that I'm seeing that I'd like to see more of, and kind of where we're focusing too, is the service support of our products. So in the case of our Nucleus system, we have a remote monitoring capability. So I think, you know, anytime you can reduce having to go on site, reduce having to send technicians on site to fix equipment is key. You're staying out of the way of the clinicians, and you're giving a sense of security to the IT staff. So, you know, that remote monitoring of equipment, we'll know ahead of time before there's a problem, before the end user will even know there's a problem, by, you know, remotely monitoring to make sure that things are working flawlessly and preventing any kind of downtime, because that really is key to hospitals increasing their revenue and keeping those flows coming. So that's primarily where I see the investment of technology. And then, of course, as I already said, AI, you know, and the many different ways in which AI can be used to improve patient outcomes, to improve treatment, is really going to be very exciting to see, and how hospitals will adapt that technology and how medical manufacturers will adapt that technology. So those are some of the areas. And lastly, just to focus on minimally invasive surgery, as I mentioned, that's where Sony really plays in the healthcare space. Anything to reduce hospital patient stays. We're seeing a lot of new trends in robotic surgery, and our displays are really changing the way in which surgeons and staff are doing robotic surgery, increasing visualization. You can see oftentimes in movies, 3D wasn't so successful, but you could imagine the power of having 3D in an operating room and allowing a surgeon to have that 3D spatial view along with the staff assisting in that surgery. It's really groundbreaking. So I think we're going to see more of that as well.
Okay, great. Well, Maggie, I remember you sending me an email, I think it would have been late last week, about something you saw that Kaiser Permanente and Mayo were doing. And it seems like it's definitely an evolution in healthcare. I don't know if you want to talk about it real quick, what you saw, but it definitely was an interesting
Yeah,
new
absolutely.
trend.
Yeah, it's definitely a new trend. So yeah, the article you're referring to, and actually my VP of Technical Operations sent it to me. So Kaiser Permanente and Mayo just released this article about how they're teaming up on investments in acute care at home. So there's going to be this huge shift to virtual platforms for patient care, which is really interesting. And actually, it was something that I was fairly familiar with because one of my customers, it's a large health system, they're currently developing what they call the patient room of the future. And it was really interesting because as we're working with them on a digital whiteboard solution, and as we were talking about their patient room of the future, actually they see that patient room being at home for the patient. And this was a goal for hospitals pre-COVID, but it certainly was accelerated by COVID. So mobile devices and telehealth being huge for hospitals right now, and that's definitely where they're trying to invest. So for us at MDM, we're very focused on cloud applications on mobile devices and sending patient education to those mobile devices.
Okay, great. Yeah, it was pretty interesting to see that. It's kind of this shift that's happening due to COVID and everything else that's going on. So wrapping up here pretty soon. One of the things I think I've shared with all of you is I always like to ask a bit about the technology that you experienced during COVID, personally as well for work, that you thought was pretty game changing. I've heard everything from air fryers to cameras to electric bikes, down the list of it. So kind of interested to hear what you guys have to say. I'm going to start with you, Matt. What's that technologies that during COVID you've used? Matt.
Yeah, for me, one of the things kind of talking about virtual experiences, keying off what Maggie was just touching on, not VR. I'm not putting on the VR goggles, but kind of augmented reality experiences for cycling have been really interesting. So doing a cycling trainer at home and putting up on an iPad and being able to ride with others. One of the things that was kind of a pain during COVID is we weren't able to do bike rallies and rally rides, but rather than going out and just riding on our own, we could still get together and do that. A little bit different than the Peloton stuff, a little bit more gamified, but having that app where you can gamify that experience and still be together was really fun for me.
Cool. How about you, Thomas?
For me, it's about enhancing customer experience and patient management of hospitals or the clinic. Before this pandemic, it's actually in Asia side, we have this SARS that happens about 7 years ago. And it's kind of happening in Asia, but it's not worldwide. But this pandemic, this COVID, actually, it's a global thing. What I think of is what will happen in the next 5 years. Do we have a pandemic response solutions ready? Which I think this open up a new opportunity, all right, for us to really look into it. And one of them for me is experiencing a animated virtual assistants. Because of this pandemic, it really needs a technology for me to keep contact either with a doctor or nurses through this virtual assistance. Yeah.
Okay, cool. Julie, how about yourself?
Yeah, mine's pretty simplistic. I would say probably the most impactful technology is very simple, which is our Zoom meetings and team meetings, and how on a personal level we use that really to stay in touch with family and friends throughout the pandemic, particularly some of the older relatives who are alone and gave us access. So not just telehealth, but also, I guess, telesocializing in a sense, and how great that's been for us to all, connect in a way that doesn't cost money to travel, or, just to celebrate special occasions and have multiple people join at once, whether it's personal or business. You can see how impactful having that technology really is to our everyday lives. So I have to say that's probably it.
Perfect. And Maggie, what's the great technology that you got to experience during the pandemic?
Well, this is definitely not original. I know everyone's probably using it these days, but I must admit, I'm kind of embarrassed to admit, I'm a self-proclaimed foodie. And I live here in Dallas. I love going out to restaurants. That's one of my favorite activities. So unfortunately, since I wasn't able to go to my favorite restaurants during the pandemic, my favorite thing to do was to, use my Postmates, Uber Eats, Grubhub. I have all the apps. And so, I was able to support my local restaurants. I even am still doing it now, even though I can, Dallas is open back up, but I'm still, even last night, ordering from some of my favorite restaurants to support them. So that has helped me a bunch this past year.
Excellent. Well, being a new dad, I have a 7-month-old. It's pretty much been anything and every technology that keeps me sane and awake late at night with her at 3 in the morning when she wants to say hi to everybody and not sleep. So it's pretty much anything on my mobile device. Well, I want to thank everybody, Maggie, Thomas, Matt, and Julie. Great conversation. Thomas, I really appreciate you staying up late in Malaysia. This is the first international RVonAV that we've done. So thank you very much. I appreciate everyone's, ideas, thoughts, and message. I mean, healthcare is an important business for us all. I know within B2B, within Sony, Intel, Maggie at MDM, Reflex Systems, this is a big business for all of us. And it's important that we're finding ways to help our customers, our partners, deliver the right level of care and information to the patients. So thank you very much. We do have some upcoming next Tech Tuesdays. We have a great one coming up here on June 1st, talking about our Bravia displays and with our new partner for integration, TSI Touch. So I know, Matt, you talked a little bit about touch interactivity. And so Thomas, we're really excited about this new partnership with TSI, and we're excited about that next Tech Tuesday. And then also on June 15th will be the next RVonAV, and it will be focused on digital signage as we gear up towards the summer and a lot of the new virtual events and in-person events that'll be coming later in the year. Want to really kick off some stuff around digital signage. So with that, thank you very much once again for attending.